happens, and maybe both things could be true, that you have a single sort of system, whether it's a particular system or it's a type of system, and also starting to see less bricks and mortar sort of structure at the same time. I think the second part of that, I think, is probably true. I think that there's always been this push to try and get patients out of the hospital as quickly as possible from an insurer perspective, because that is the most expensive time, obviously, for an insurer to be paying. So this telehealth thing is feeding and hitting all those chords, obviously, for payers, as anyone could probably surmise. I think as far as the first part of the question, I mean, I have been following along what was originally called the ADC, the Amazon Berkshire Chase sort of healthcare plan. Then Atul Gawande, a lot of people may know him, of Amazon and Berkshire and Chase. And I think that was sort of their idea. Ultimately, they wanted to see, could they create a single system for all of their employees that would be a better system than either the federally reimbursed systems like Medicare or Medicaid or the VA or the private systems. And, there's I think, 20 years ago, I started writing about healthcare policy, Jeff, and I think that's what took me into this field in the first place. So in some ways, when you ask this question, I think for 20, 25 years, people have been wondering, will there be a single system in place to oversee healthcare? Call it a single payer system, call it a government-run system, whatever it may be, I don't know. Could it be a private system that essentially does the same thing? Perhaps. I think that the same metrics by which we measure everything within healthcare, and certainly you as a healthcare policy writer, would apply. What are we getting in exchange? Are we getting a better, cheaper, more efficient healthcare system? We're a healthcare system that spends $3.5 trillion on healthcare every year in this country, and we're 35th, 36th in the world in terms of overall mortality. Those are the big numbers that often are ascribed to our country. We do very well at taking care of some of the sickest patients with some of the most unusual problems, whether it be cancers or other problems, but we have a hard time, obviously, preventing a lot of the disease that lead to these costs in the first place. We know that 70% of chronic illness in this country is completely preventable. So would this system, whatever it may be, an Amazon-type system, how would it reasonably prevent healthcare costs by preventing some of these illnesses and diseases in the first place? How are they integrating the system into our lifestyle? So it's not just telehealth, it's all the time. I mean, I'm wearing an Apple Watch that, I get some data on, which I enjoy. I like data on my sleep and my movement and things like that. But how am I making that actionable data? Is this a system that is essentially a central nervous system with all these tentacles and nerves reaching out into communities to essentially create actionable change? I think it's quite possible. I get frustrated sometimes because I feel like in some ways I've been talking about some variation of this for 20 years, and there's a lot of institutional barriers. It shouldn't require a pandemic to force the changes that we've seen in telehealth. But I do think that the idea of what you're describing is the right idea. I just don't know why some of these things haven't already happened, frankly.
Well, it's interesting. I think there's probably going to be some term that emerges, that's the digital equivalent of bedside manner. Digital manner, or the digital bedside, or I don't know. There's some phrase from there. I'll let someone figure that out. But really speaks to how the seamless interaction between the physician and the patient, then moderated by technology that is assistive to both, really helps the patient perceive a level of care and a level of both health care, but also caring on behalf of the provider. That creates more adherence and adherence to treatment, but also more loyalty to maybe the healthcare provider and to that business. And it's interesting. I remember just maybe a couple of years ago, my son, who was young at the time, 3 years old, fell at school, hit his forehead on the corner of the table, and had a big gash, and needed to get rushed in to get it stitched up. So I got a call, and I ran out of work and went to the hospital. And at the end of the visit, the attending doctor said, we do this follow-up phone call with you because you're in the ER. We do an automated thing. It's 4 days from now. You're going to get a call asking you how your visit was. And the thing is, nobody answers the phone anymore because you get some phone call from some random number, and so no one answers it. And so he's like, I'm doing a trial to see if actually instead of sending a phone call, we sent you a text message asking you how your visit was. And all you have to do is reply 0 to 10, and that's all you have to do. And I'm doing a trial to see if we can get more people to actually respond via text than phone calls. And I'm like, dude, you have no idea who you're talking to. I run Twilio, and there's no doubt in my mind that you are going to get more people who will hit one digit reply to a text message as opposed to answer a phone call from some weird number and take a survey on the phone. But it was sort of this idea that we're going to do a trial, and it was sort of like, I'm hoping you'll participate. I need your consent to participate, like a very standard sort of medical experiment kind of focus on it. But you sort of think about some of these no-brainer as far as being rigorous in clinical trials, but other ones maybe being a little too much so. That are low risk and high impact things that providers can do to really help make patients' lives better. And it's it just strikes me that COVID showed the world that. It showed us that the worst case scenarios that people might worry about, the things that cause people to take a decade to roll out these things, you know what, maybe it wasn't merited. Maybe we can roll these things out faster. Do you think that's true, or am I not giving enough credit to the scientific process here?
No, I think you're absolutely right. I mean, and again, because of your interactions now with the healthcare system. I mean, it's an inherently conservative system. It has a lot of inertia going in a particular direction, and it's easier to resist change unless there's data to support that change. And how do you create the data? You got to actually do things. And so, you see the inherent dilemma when it comes to studying a new cancer therapeutic. It's one thing. When you're saying we're going to create a sort of structural change in how we interact with patients, there's a lot of doctors who don't even still email with their patients. That it's still got to be a phone call or an in-person visit, and that's just not how the world works. It ends up being a big conversation at a lot of our grand rounds, just in terms of how we continue to evolve with the times, especially at a tertiary care center. Because as good as we can be at taking care of very sick patients, the idea that we're providing good patient experience is something that I think a lot of times gets forgotten. You reminded me, Jeff, it's funny, you talk about the phone call versus the text. Again, I mentioned I have 3 teenage daughters, and we've been pretty good about devices in our house. It's been a big point with us, and but they have devices and they are on them. And I remember thinking they text a lot. They hardly ever talk. They're always texting. Talking would be a big thing, actually, talking to someone. They don't do that very often. And I remember saying to myself, had we come up with texting first as part of this communication device, and then one day, 10 years into it, said, hey, by the way, if you want, that would have been amazing, right? My kids would probably be talking all the time. And the same sort of thing is true in medicine. We came up with, for example, chemistry in terms of therapeutics before we started thinking about electricity in terms of therapeutics. So most of the therapeutics we have are based on drugs. Pills that you take into your mouth, IVs, things that you put into your bloodstream. And now we're starting to see more and more electrical stimulators, things that are stimulated near a woman's ovary who has polycystic ovarian syndrome and can't make enough eggs, for example. Within the brain, we do it for things like Parkinson's disease, but also looking at it for things like obsessive compulsive disorder. Electroceuticals versus chemoceuticals. It was just a question of when did we actually arrive at some of this knowledge. As we evolved, we started to think those things are cool, but if electricity had come first, we would probably be focused more on electroceuticals in this country. I bring it up just as a metaphor for what you're saying. When we learn something, ends up really dictating, I think, how it's adopted, which is obvious. But then if you go backwards, you think, well, that was it? That's the reason people don't talk on the phone, because it was first, or that's the reason we use chemicals instead of electricity, so it's just something I always keep in the back of the mind.
Going back to where you started, right? Every time something new comes along, it is phrased within the context of the things we already know, right? So what is normal, what is weird, what is not weird, kind of back to your, SARS, MERS, and, framing of COVID. All right, well, I think it's time that we should go to some audience questions, because we know there's some folks from the audience who gave us some questions ahead of time. So why don't I do that? I'll read the questions that the audience submitted. So our first question is from Derek Thompson. And Derek's question is, what methods and mediums of communications have you found to work best in conveying medical information to various communities?
Well, the answer to this question is evolving. I mean, I remember, for example, the National Academy of Medicine and the in-person meetings that we do yearly, sometimes biannually, are some of the biggest sort of events of our entire academy. And actually meeting people face to face, not just for the sessions, but also in the hallways, the sort of sidebar meetings, things, more chance meetings, I think have been how a lot of information is transmitted. I got an idea for a project. When I'm at the National Academy meeting, I'm going to find so-and-so, going to buy him a cup of coffee or her a cup of coffee, and we're going to sit down and talk through it. That's how a lot of sort of the background meeting were occurring. Obviously, we have the journals and we have a real how we publish information. I think it's changing right now. I do tons of meetings now just like this over some technology where I'm talking to people, and I'm doing it whenever I want. I'm doing it on the weekends. I'm doing it when I have the idea. I'm not waiting for a National Academy meeting. And one thing that is happening a lot, and there are pluses and minuses to this, you're starting to see a lot of what we call preprint data being shared. So people actually, they're doing research. Obviously, a lot of it's COVID related right now. They're starting to get some early data, and they're going ahead and writing a quick article. Sometimes that night, you're in the lab during the day, that night you write a quick article. Here's what I'm seeing in these 8 patients. You put it out as a preprint, and all of a sudden it can be shared with the world, everybody. Now, sometimes that's not always good data, or it's too early data. So you have a crowdsourcing going on of really evaluating this in real time. So I think it's changing so fast, Derek, that it's tough for me to contextualize all the positives and negatives, but I think net, it's positive. I've always been an information guy. I think the more information, the better. I think we have to continue to be truly scrupulous in terms of how we look at data, just because it's out. In the past, when something got published, you knew that it had been peer reviewed. You knew it had a certain sample size. You knew it had a certain significance in terms of the sample size, whatever it may be. With preprint data, it is causing the crowd, in this case the world, especially the world of scientists, to look at things real time and still apply that analytical eye to it. So it's different. I'm at home. I'm living in my basement primarily, and then I feel in some ways I am more connected, at least with people in my specialty and my areas of interest, than I was before.
I'll add one quick note to that, and not from a medical specialty, but I think across many different areas. What we have seen is things that used to be done locally. So you'd have a conversation, maybe it was a meeting, or even just like an informal, like a happy hour, or a hallway conversation, or whatever it is, or even a conference where it was defined by the people who are right here, right now, are having this conversation. And what we've seen now with shelter in place and all that is those conversations become global ones. Like, we're going to talk about this topic, and anyone around the world who wants to join in is able to do that, and that actually has taken conversations from 5 people to 500 or 5,000 people pretty much instantly, and that is there's upsides and downsides to that. Now I'm going to move to the next question from Dr. Gohar Sheikh. How do we keep up with the technological changes in healthcare communications while focusing on patient-centered care and now implementing COVID infection prevention protocols? And how involved does the healthcare professional need to be in this new technology, or do we just leave it up to the experts? And I thought that was a really good little add there.
Yeah, no, I mean, this is the heart of the issue, Doctor. I think that, first of all, and I mean this in the best possible way, but we've really had no choice because of the stay-at-home orders in terms of how we are communicating, certainly with each other, and in many cases with patients who were advising, look, if you need to see me, but it's not an urgent problem where you need to be coming to the emergency room, let's do this via a telehealth visit. You're going to cut down on the amount of personal protective equipment that everyone's going to have to wear when you come into the ER, because we have to assume you have the COVID disease, even if you're coming in for your back pain or your leg pain, whatever it may be. So it's been forced, but I mean that in the best possible sense. I really do. I mean, there wasn't as much kicking and screaming going into this, I think, as people sort of anticipated there might be initially. People really got on board quickly. There were training sessions for physicians, including myself, where we went through it. And some of it was very basic, but some of it were these insights that I hadn't really considered. Take advantage of this telehealth visit with the patient at home to understand their environment in different ways and create that sort of connection, Jeff, that you were mentioning, that loyalty that you were mentioning via the screen in ways that maybe you couldn't even have done in the office. You're on their turf as opposed to them being on your turf, the white coat, hypertension, all that sort of stuff. I don't mean to minimize the in-person sort of relationship, and I think in many cases it's still very necessary, and for some patients it's still going to be what is necessary for them to feel comfortable with the type of knowledge that they're getting from their healthcare provider. They need to hear it firsthand, directly, personally. But and obviously for more significant issues, things where you need to actually do a physical exam real time, certain lab studies need to be done, a scan, whatever, things like that. Patients are going to need to leave their homes and go get that done somewhere. Maybe not always at the hospital, but at some particular location. And I don't think that's going to go away. We're still going to need to get data on people and to best understand how to proceed. I think we are seeing that maybe, Jeff, I think you made this point earlier, maybe we need less data than we realized. Maybe we inherently, as part of that conservatism, we tended to order more tests, do more procedures, whatever it may be, than was really necessary to justify, and we weren't getting better outcomes because of that. I think that's one of the issues in our healthcare system overall. We spend a lot of money and we haven't had as much to show for it. Our outcomes aren't necessarily better for a lot of these particular diseases. So again, the questioner, that doctor who's asking the question, maybe has a little understandable resistance to where this is headed. Maybe not, but I think that what we're learning, and it's just been a couple of months, is that it does seem to be, the adoption seems to be very rapid among many specialties, and we're starting to see an improvement overall in the patient relationship and without any disruption in outcomes so far.
Yeah, I'll give a quick postscript to that, in particular the healthcare professional versus the experts aspect of that. So I think it's a great question. And what I've seen is that, if you roll back the clock 20 years when everything in technology cost millions of dollars and took years to roll out, it made sense that, a hospital had a head of IT and that person made a big decision and a long rollout period for a big piece of software or something. But now, access to this technology is actually so convenient and so inexpensive that I think that's a great democratizing force. And so whether the innovators who figure out this is what patients need, this is what makes patients happier, this is what makes patients is a more convenient solution, or this is what makes patients actually their healthcare outcomes better. That is such an accessible idea. You mentioned Parkinson's. There's a doctor in the UK who runs this thing called the Parkinson's Voice Initiative, and he had an idea to run a trial to ask the question of if by having somebody call into a phone number and recording 60 seconds of their voice, if you could actually diagnose early onset Parkinson's. And he had this idea. It was a question, right? He's like, he thought it was possible. And he tells the story. He says, in ordinary circumstances, that would have been, I'd have to go out and get a grant round of funding. It probably would have been, in the hundreds of thousands of dollars. Then I would have had to hire a whole team and go build out a thing and buy hardware and blah, blah, blah. It would have taken a year to 2 years and required a lot of grant funding. He's like, and I picked up Twilio. I built that thing in, I think, a week, he says. They just allowed someone to call in, record their voice, and they piped it through the software that they had built to analyze it. And they collected many thousands of samples in the course of like a month. And within a couple of months, they basically finished this trial. The whole thing cost them less than $1,000. And he proved with statistical significance that, yes, you can use the telephone to diagnose Parkinson's. And that whole thing took a couple of months and about $1,000, as opposed to millions of dollars in grants and in years and all this kind of stuff. And so I think about if a physician can partner with someone with technical talent. You don't need an engineering team of 100 people. It's like, 1 or 2 developers who know modern web technologies, things like Twilio or Amazon Web Services and some of these things. And obviously you need to, think about HIPAA and privacy and all that. and that's why Twilio making our services HIPAA compliant earlier this year really opens up the floodgates for physicians who have an idea to be able to say, I can pull in a developer and actually build something relatively quickly to prove out a hypothesis, and then actually ask if we can scale it up. And I think there will be so many new opportunities arising because of the lower cost and lower barriers to entry of a lot of this technology. And so I would just encourage folks, obviously, to work within the confines of your medical system and data privacy and all the ethics. And I'm not telling you to bypass any of those things, but within that context, the cost and the barriers to actually trying these things from a technological point of view have gotten so low. And I encourage folks to think about, great, how can we use that fact to actually accelerate proof of hypothesis around ideas that folks have?
No, it's such a good point. I'm glad you answered that second part of the question. This idea of are the experts are always going to be necessary, but I do think about how this grows. Right, going back to telehealth. Now we can do what we did in the office, but I'm seeing in my own environment. But the idea that it can start to be predictive in some way. I think with the PVI, the Parkinson's Voice Initiative, someone would start to develop laryngeal sort of spasm, tremor, before they'd ever notice any tremor in their body. He was being predictive in a way, looking at voice patterns, which was fascinating. Predicting these before the patient would even think about it in some way. Can telehealth start to do that as well? Can we, through these other technologies, again, I'm biometrics, wearing wearables, whatever. When I ask you, Jeff, how you doing as part of the visit, it's not just, hey, I'm doing okay, doc. I actually know how you're doing. I know how you're doing because I have a readout of sort of Jeff's life over the last, few months or since his last visit. That is through an AI platform, giving me a picture now. Is he living a green life, where he's doing really well, or is he more orange? And if he's more orange, why is he orange? What's going on? Why is he always stressed at 2 o'clock on a Tuesday? What's going on at 1 o'clock on a Tuesday that's always stressing him out? Why does he never exercise on this day? Whatever it may be, to start to really create that via telehealth as the entry point, I think is fascinating. Predictive, we're just not good at it. We don't invest in it. We could have predicted this pandemic in some ways. That's going back to the beginning, I guess. But can this be used as an entry point to really address these preventable diseases in a way that is much more frictionless for patients, where I'm not just getting blanket advice to eat broccoli and walk 10,000 steps, but you're different than I'm different and someone else is different. We all have different strategies that can start to really be refined by starting to combine all this. So I think the experts and the inflection between experts in medicine there's still going to be a lot of places to grow.
It seems like a true opportunity to develop this 360-degree picture of the patient, because you combine what you just said about the wearables and all that kind of stuff with the notion of, and I can see you in your natural environment. It allows probably an unprecedented ability for care providers to really think about their patient and what their life is, not just the 20 minutes spent with them in an exam room answering some questions. And so I think that feels like, probably the bigger picture of things, like that will start to develop more and more and more, and then that'll build more loyalty. If my doctor really knows me and they know my full picture, that will actually build that relationship with the care provider.
I think we are just. By the way, I'm just going to show you. My wife handed me this as we were talking. So there you go.
Oh, wow!
Okay? Nice. I'm up in my game here.
You wearing those on the court?
They've mostly just been sitting in my closet lately, but I thought you'd appreciate that.
Nice. That is awesome. All right. Well, I wanted to thank you, Sanjay, for joining us today. I want to thank everybody who's watching for joining us today. I know how busy everybody is, and I know how many of you are also sick of these types of video conferences, whether they're webinars or whether they're talking to your colleagues. But I hope you leave today feeling a little bit more informed about some of the things that are going on in the macro sense in the healthcare environment. And I also hope you feel inspired and maybe a bit relieved that actually the solutions to the many hard problems that we face as a society and as healthcare providers and those serving healthcare providers, these are things that we can build. These are things that we can do to transform engagement with our patients. And it's especially important to have that belief in our ability to build during this period of time. because we are rapidly rebuilding how society works right in front of our eyes. And so, meta message is like, you can do it. Every organization is able to build the future. And that's such a powerful idea. I want to thank Dr. Gupta for coming today, for giving us his time. It was an honor to be able to have this conversation with you and to hear your perspectives on what the future holds for healthcare. And I also want to use this opportunity to thank all of the workers who are on the front lines of this pandemic, because we are all truly heroes as well. It's the truck drivers, the food delivery workers, the grocery store workers, the pharmacy workers, the manufacturing workers, everyone who's playing a role to help keep our the shelves stocked with goods, and helping everybody to be socially distanced, helping us all to shelter in place, and helping us to actually heal when we are in fact sick. So thank you. Thank you to all of those people for doing what you do for the rest of us. And with that, I want to transition to the breakout sessions. And so there's going to be 2 buttons on your screen in a minute that you can click to take you to where you want to go for a breakout. Before we do that, I want you all to take the opportunity to give us feedback about today's session, so we can tailor future Twilio Engage Everywhere sessions and make them even better as we go. So if you could just send a text message to the number on the screen that you see. It is a very quick survey. It's just a couple of questions, and it'll help us to tune these conversations going forward. We'd really appreciate it if you took the time to do that. Thank you, everybody, for coming today. Thank you again, Dr. Gupta, and I want everybody to stay safe and healthy, and build on. Thank you, everybody.
Hello, I'm Matt Kresh, Director of Industry Marketing at Twilio, and thank you for joining our discussion on telehealth best practices. Today you'll hear from our Twilio experts, Jessica, John, and myself, and we're very pleased to welcome 3 healthcare innovators. We'll be hearing from those thought leaders throughout this best practices session. You'll hear how Aspheria is increasing access to care while ensuring staff safety, about LumaHealth's one-click healthcare system, and how Cycle.net is providing a path for deeper patient engagement and follow-ups. Stephanie is a working mother of 1 and is overjoyed to have her second child on the way. She's feeling a bit stressed about what her regular doctor's visits will mean for her schedule, because she'll either have to arrange for childcare or take more time off work. While her daunting schedule is getting in the way of her ability to really stay focused, she's thrilled with the ability to learn that she and her new family can benefit from incorporating telehealth into her prenatal care plan. She wants to do everything she can to make sure she has a safe and healthy pregnancy, but at the same time, minimize time away from work and family. This time, she'll have video appointments for her 16, 24, 30, and 34-week visits. That means a quarter of her visits won't require the additional 2 hours that it takes to drive, park, check in, wait to get into the exam room, and wait for the doctor. For Dr. Smith, it's a chance to see Stephanie in her own environment, adding important insights she can bring into the quality of care. The other thing that's new for Stephanie during this pregnancy is all the communications that she gets over SMS, her preferred means of communication. in the course of her pregnancy, she'll receive over 20 articles and will be pointed to topics that will cover each of the topics in her upcoming visit, so she can prepare the questions she wants to ask. Dr. Smith has seen that sending articles like this means her patients are more likely to integrate the material into their wellness plan. Stephanie's also taken the option to get her labs over SMS. Stephanie's tested positive for gestational diabetes. She's able to record and submit her sugar levels directly into her medical records and receive regular guidance, reminders, and advice on her daily dietary plan. What Stephanie expected from telehealth was convenience, and she got that. But the real bonus has been that she feels more connected to her doctors and her care team. What's important to Stephanie? She needs to be able to schedule her appointments, balance her time between virtual and in-person visits, and stay connected for the best possible follow-up care. In today's world, there's not just one Stephanie, there are millions of her, and the challenges of staying safe while getting attention can be daunting. That's where telehealth comes in, and the adoption is staggering. Since the beginning of the COVID pandemic, G2, a software marketplace, reports that there's been a 372% growth in the telemedicine software category. We're seeing this kind of unprecedented growth everywhere that the new normal creates a need for rapid adoption of digital channels. Now let's dive into some details and follow the telehealth patient journey. You'll see where you can change and improve your patient experience and operating efficiencies. Here's Jess to lead us off.
Thank you, Matt. As you saw with Stephanie, there are a lot of steps in the patient journey. In turn, there's a lot of things to consider when building telehealth solutions for both patients and providers. So we've broken it down into steps in the patient journey to show how at each stage you can improve the patient experience with specific outcome costs. Next is support, triaging patients over video telehealth appointments to ensure that only those who need to come in do, while providing a quality virtual care experience. And finally, maintain post-care follow-up to make sure patients are adhering to the prescribed regimens. Bringing these components together with telehealth, you can bring patient care back into the home. The first step we're focusing on in the patient journey is engaging with the patient. What we mean by this is how do you get the patient through that metaphorical door? And we know that this is no easy feat. Traditionally, scheduling, confirming, and changing appointments has created operational overhead for providers and a poor experience for patients. Automated appointment reminders are sent as one-way impersonal mass text messages that cannot be acted on. Office staff oftentimes have to individually call patients to confirm appointments and spend hours upon hours doing this. And finally, when patients need to reschedule appointments, they're often having to call into the office to reschedule during office hours. For folks who have 9-to-5 jobs, this can be very inconvenient. Personally, I struggle with this. My calendar on a good day resembles a game of Tetris, which means if I need to reschedule an appointment or call my doctor's office, I literally have to block out a chunk of time in my calendar to make sure I go and do it. Otherwise, it just doesn't happen. An article published by Forbes mentions that missed appointments in the U.S. alone cost the healthcare system $150 billion a year. Taking an API-first approach can help you take that burden of appointment scheduling, reminders, and rescheduling off of your staff while creating a better patient experience. A couple things to keep in mind if you're going to do this. One is ask for channel preference and respect them. Some patients may want to communicate over text, others over the phone. Next, don't forget to provide fallbacks. While some patients might want to be contacted over a text message, if you're not getting a response, escalate to a phone call. Or if they give you a landline number, give them an automated call so they get that message. Also, when making automated calls, don't forget to employ technologies like answering machine detection to ensure that your message is actually left after the beep. You don't want any awkward cutoffs in your voicemail. And finally, provide same environment with scheduling. What I mean by this is if you send an SMS appointment reminder, enable two-way messaging so your patients can confirm or respond over text message. Or if you're doing an automated call, append that to an interactive voice response system or IVR so patients can confirm, reschedule, or request to speak to someone in the office if they have a question. All right, so let's take a peek at what this looks like from an implementation perspective. The first thing is that the patient interacts with your system in some way, like booking an appointment. Then your system calls our channel APIs, generally via server-side or client-side SDK, in the programming language you prefer. Then, depending on your actual need, you might need to perform some sort of number masking. For example, if you're bringing a patient and a provider together, you may want to conceal their real numbers. All of this happens in software we call the super network, which abstracts away the complexity of dealing with geographies and carrier networks. Then, the message gets delivered either over text message or perhaps over an automated call over the public switch telephone network known as the PSTN. This pattern is one of the most common ways we see healthcare organizations implement notifications on Twilio. You'll hear more from this from Asperia in a few minutes. But before we do, let's go back to our friend Stephanie to see how these elements come together to shape the engagement part of the journey. First, she called in to schedule an appointment and uses their IVR to do this automatically without having to talk to them in the office. She then just receives a text message confirming her appointment. About a week before her appointment, she receives an SMS reminder asking her to confirm, reschedule, or cancel her appointment. She doesn't hear back, or she doesn't respond because, Stephanie's a busy working mom of one. She forgets. So then the office sends an automated voice call where she confirms the appointment through their IVR. She realizes there that she has a question about her upcoming telehealth visit and requests to be transferred to somebody in the office so she can speak in person. The results of implementing appointment reminders speak for themselves. Veteran Affairs is the largest healthcare system in the United States, serving more than 9 million veterans. To address the challenge of having over 9 million underutilized appointments due to missed appointments, they launched a new solution called VetTech, which is a national appointment platform. What it does is patients can receive text messages asking them to cancel or reschedule their appointments. This in turn frees up appointments to waiting veterans. This has resulted in savings of over $100 million from fewer missed appointments. These tactics can also make a difference in patient attendance. By implementing Twilio voice and SMS for appointment reminders, Arkansas Children's Hospital saw a 90% decrease in missed appointments. And now, I'd like to introduce you to Chime, co-founder and president of Asperia Health. He'll be sharing how hospitals are increasing access to care while ensuring staff safety.
Thanks, Jess. As the COVID pandemic started, Catering Health, a large health system from Ohio, collaborated with us to develop EHR integrated IT solutions to restore patient access while ensuring staff safety. Let me share a couple of these with you. While televisit has seen great adoption, still majority of patients need to be seen in person. And as you know, some of these patients who come for their appointment may be infected. At Catering Health, our EHR integrated chatbot engages thousands of patients every day in the morning. And if the patients respond that they are having flu-like symptoms, patients are advised to call the clinic. At the same time, we create an in-basket message for staff so that they are aware of potential infection risk and can handle such patients in a safe manner. So, if you can you go to a previous slide, please? So, if you look at the impact, an infected patient is capable of infecting at least 3 more staff members. Front desk, a nurse, and the doctor. Now, let's look at rescheduling cancelled elective procedures. The hospitals have prioritized patients that need to be rescheduled based on the risk and other factors. Every day we are reaching out to 150 patients at Catering Health. And here you see social determinant of health, known as SDOH, at full display. While you may want to call and schedule patient who selected option 1, you also want to follow up with patient who selected option 2. In today's environment, it's very likely that the patient lost her job and as a result the insurance coverage, and that's why she is declining the procedure. You know, because this patient is not getting the procedure that she should have, these patients would start to show up in ER in a few weeks down the line. So by providing this critical piece of information, we are helping hospitals proactively manage such situations. Working with Twilio and our EHR partners, we have enabled many such workflows. As you reopen your hospital after the lockdown, you will discover new needs to engage patients. And I would highly encourage you to consider multilingual SMS-based chatbots to meet such needs, just as visionaries at Catering Health did. Back to you, Matt.
Thank you, Chinmay. Great example of the engage phase in use. Once you've booked your patient and reminded them to show up for their appointment on time, the next stage is how you support your patients. What does the actual appointment experience look and feel like? To start, let's understand what patients are looking for. In-person visits are not a one-size-fits-all solution for patients or providers. Perception. Sometimes it can be hard to determine if you should go in for an appointment. I suffer from allergies, and it can be tough to know if I have a cold or if it's just a really severe hay fever. Geography. Depending on where people live, such as in rural areas, healthcare can be less accessible. And cost. Visiting the doctor, particularly in the US, can be expensive, but we're seeing better reimbursement for telehealth, and this has been a welcome change for everyone involved. This is good news since we know that patient preferences are changing. Not only is telehealth a solution that works in the time of COVID-19, patients have already been wanting to interact with their providers online. In fact, according to a medical economics study, 79% of patients who choose a provider that has the ability to interact online. And according to Liquid State, 60% of millennials prefer telehealth appointments. While before telehealth appointments were a choice, now in many situations, it's a tool to triage patients so doctors can determine who can be treated based on an initial virtual visit and further determine who should come in person for consultations, testing, treatment, and how much of the care can be addressed virtually. This is new for many providers. When building telehealth solutions, keep the following in mind. You need to plan for scale. Are your patients local or are they distributed geographically? The location of the video server will influence connection times and the overall latency. Do you need to scale to high volumes of users? Do you need to get up and running quickly? You need to have the right precautions in place to protect your patients. Not only authentication and authorization, but you need to consider the types of information that is shared in your video application. There are various privacy and compliance standards worldwide, such as GDPR and HIPAA. A key component is the video quality itself, and you need to deliver a quality video experience. What devices and browsers will the patient be using? Will it be easy for them to connect? Will the solution be able to adapt to different network conditions like Wi-Fi or cellular? How does it feel for patient and provider in the actual telehealth experience? When delivering telehealth appointments, you need to shape the experience to match the use case of your patients. Do you need to send reminders via SMS or URL links to the video room? If a participant doesn't have an internet connection at the time, can you fall back to a phone call? What is the user experience you want to achieve? Do you want one-on-one consultations or multi-party experiences with the ability, for instance, to include a family member or an interpreter? Let's take a peek under the hood and see how this works from a technical perspective. Patients and doctors join the Twilio video room with their audio and video tracks passing through the media server. Another participant, say a family member, is able to dial into the Twilio video room through the PSTN and get connected. Going back to Stephanie. Stephanie receives an SMS reminder with an embedded video URL. She joins the virtual waiting room. Her mom wants to join, but is in the car, so she dials in over the phone. And her doctor joins the video room from her desktop and conducts the consultation. It's important to have all these elements in place for a successful telehealth visit. One of Twilio's customers, MD Live, has prioritized the ability of their telehealth video experience, which has resulted in a 16% increase in video consultation success rates. And now I am thrilled to pass the mic to Aditya, CTO and co-founder of Luma Health, who will be talking about their seamless telehealth experience.
Thanks, Matt. Appreciate that. My name is Aditya, and I'm the CTO and one of the founders here at Luma Health. Needing to see a doctor is hard. Being able to see a doctor shouldn't be. And that's really the core ethos behind what we build and what we aim. Access. How do I make it easy for patients to get access in a rural setting? Maybe patients with limited mobility, patients with limited access to transportation. Was 70 plus EHR integrations from the likes of Epic and Cerner on down to the massive different EHRs that exist in healthcare delivery. To be able to shift an entire schedule, an entire physician schedule, an entire location, a facility, over to telehealth in a matter of hours. And what that really enabled our clinics to do and our partners to do is switch the ability to deliver care, even though there was still a shelter-in-place order. Now, one of our launch customers, Houston ENT Specialists, now they're a large 12, 14 location physician group in the greater Houston area that provides ears, nose, and throat services to patients. They came to us and said, can we actually deliver video visits while the state of Texas is sheltering in place? So what we worked with them on is really a three-step approach to actually convert their schedule to allow them to deliver televisits on top of the Luma platform powered by Twilio. So first we aim to evaluate their process and build that plan, not just for COVID-19, which I think is really critical, but also this new normal. What do the next 6, 12, 18, 24 months look like with video as a part of your care plan? Number two is really look at the EHR as your key element to actually switch your schedule into a televisit-powered capability. Not just delivering in-person visits now, but also those televisits. And then really thinking about the future, using that core asset that all healthcare systems have, that EHR, to really actually think about, do video consults make sense with nurses now, with loved ones? Does your, using the pregnant, the to-be mother example, does she go in, but the partner stays in the car, and then the partner joins the call from the car via video while the pregnant mother, to-be mother, actually takes the in-person visit. Lots of different modes in which care is going to be delivered, not just today, but also in the future. And the third part is really looking at the ROI behind a video implementation. Not only do you have to measure your show and your no-show analytics, but look to see for your televisits, are they different? Do you need to build a different communication cadence? Do you need to enable different features in your televisit delivery in order to get those best results? So Houston ENT was able to deliver a video-enabled solution for their physicians using the Luma platform in about a day, switching entire chunks of their schedule from being completely unserviced to video delivery, and then now planning for the post-COVID new normal as well. So very exciting ability to take all those investments that they made between Luma Health and their patients and continue to operate services to deliver high-quality care to their patients. Back to you, Jess.
Thank you, Lucia. Really appreciate you sharing Luma Health solution. I find it really amazing that you can go from a text message and in one click be sent away into a HIPAA-compliant telehealth experience with a provider. Now, the question becomes, after the appointment, how do you ensure that a patient follows the protocols prescribed? And how do you track progress? As many of us know, adherence is hard. There are many tactics we have in place today to address this need for patient follow-ups and adherence. These include things like surveys, medication reminders, and follow-up appointments. According to the FDA and CDC, medication is not taken as prescribed 50% of the time. This underscores the importance of helping patients adhere to the prescribed regimens for the sake of their health. The API approach brings automation and integration to these standard practices. It enables you to think about things like gaining more visibility into care. So now you can send surveys on the channels that your patients prefer, either text or phone call, and consider using things like bots or IVRs to automate the collection of this data at scale. We've actually seen customers implement healthcare screeners that can be deployed at scale, far beyond what manual calling can do. The next thing is automate your reminders. Send medication reminders to patients to prompt them to stay on schedule. And finally, don't forget about the human touch. While you can schedule follow-up appointments automatically using text messaging or outbound IVR phone calls, but don't forget to provide the option for contextual handoff to your office should a patient need to speak to a person. Look familiar? The implementation pattern for medication reminders or phone surveys is similar to appointment reminders, but the inputs and the outputs differ. That is, you can take an existing implementation pattern and use it for different contexts and different use cases by varying your inputs and outputs. Now, let's go back to Stephanie, who finished her most recent telehealth appointment with her doctor to see how this can work in practice. First, post-appointment, she receives daily text reminders to take prescribed medication. A week later, she receives an outbound IVR call with a survey to monitor her care. At the end of the survey, it turns out she has a question about her medication, so she requests the IVR to route her to the appropriate department to talk with her clinician. What we saw with Stephanie were that her check-ins were personalized to her care needs. Keeping patient communication preferences in mind, along with personalization, can improve responsiveness. A Twilio study showed a 45% increase in responsiveness from customers when provided with relevant customized communication. Healthcare can apply these industry learnings in their own patient care practice. And speaking of personalization, I'm thrilled to now introduce you to Sean, CTO of Cycle.net, who will be talking about the telehealth solution they built with Twilio and why adherence and engagement are so important for patient outcomes.
Thank you, Jess. Hi, everyone. My name is Sean Schaff. I'm the CTO and co-founder of Cycle.net. We are a patient management system in the hearing healthcare industry. As with everyone that's been on this meeting today, we were impacted heavily with the shelter-in-place orders that came down due to COVID-19. And we live in an industry that is a super high-touch industry, and also happens to be one that is, most of our customers and patients are in that target market of 65 plus when you think about who typically needs a hearing instrument. For Cycle, we are catering to local clinics, places that have been in business for 30 or 40 years where there might be one clinician, all the way up to large retail chains that have hundreds of locations all across the country. But also, we've delivered our solution globally. So as we think about trying to find solutions that are customer-focused and still stay in adherence to HIPAA guidelines, we also have to look for solutions that also follow guidelines around the world, as we were talking about earlier with GDPR, say, in the EU. So when the COVID-19 pandemic really hit the United States hard, and we started with the shelter in place, we actually got that notice on a Friday. And over the weekend, we started thinking about what is this impact going to be to these small businesses of, one and two providers that, now can't see these patients anymore. And what's that going to mean to all those patients who need that follow-up in care? And we've always been hearing about how telehealth is being used in other industries in healthcare, and we never really saw how that could be used in a hearing healthcare environment. Well, Monday morning we got up and over the weekend thought of a few different ideas of different ways we can help our customers, and we came up with this concept that it's not just about that first hearing test visit. Most of our patients have a 9 to 12 year life cycle with a provider. So how do we help them follow up with all of the other things that have to go on? So from that Monday morning meeting at 7 a.m., we were actually able to come up with a telehealth concept using Twilio's telehealth systems. In a matter of hours, we were able to actually get up a proof of concept. In 4 days, we were able to get a full-blown solution out to thousands of clinics around the country, and days later to our customers in the EU. And what was really important to this is that it wasn't just focused on the initial stages of getting a new customer. It was actually more about the adherence to treatment that we know is so important to everything that they're doing. And so around that idea that we have to continue to engage with patients well after they're just fitted with a hearing aid, we started to take a look at how can our customers use telehealth to help engage with these elderly patients who are used to coming into their stores on sometimes a regular basis of 2 or 3 times a month, and help them understand that in different listening situations, how they can change their hearing aids and use different measurements to help give them a better quality of life. What we've also found in our industry is that family members being a part of those visits, typically in person, drive a super high engagement for people continuing to use their hearing health instruments. And so we thought it was very important with our telehealth solution to not just have it a two-way doctor-patient engagement, but how do we also give an opportunity for that clinical provider who helps the elderly patient or maybe the family member to also join into these meetings. So with Twilio, we were able to provide a 3-way video conferencing solution that met all of the things that were important to us: security, HIPAA compliancy, globally available, scalability, and the ability to still make it feel like it's a one-on-one visit. What was really great for us is that we saw instantly, within a matter of days, thousands of clinics were able to actually get on board and start to provide these appointments, and they were averaging 23 minutes. So these weren't just quick appointments to check in and see how someone was doing. This was actually engaging with their patients. And what we're starting to see is now we're starting to talk about what does the new world look like going forward after the shelter-in-place orders are done. We see more and more clinics actually starting to think about how does telehealth look going forward for them. What they've learned in this past 2 months is that they can actually offload some of the provider work to nurse practitioners and other assistants in the clinic who can actually provide that one-on-one care on just little things about tweaking a hearing aid or doing therapies to help people know how to work with a hearing aid, or working with those family members to understand what it's like for the person who now has a hearing aid. A great example of a way that telehealth has really helped some of our customers is a big customer of ours on the East Coast, Beltone. They actually use a combination of in-person and telehealth to provide quick access as we were going into these shelter-in-place orders. What they were actually able to do is provide a drive-up service where patients could come drop off their hearing aids without getting out of their car, a white glove treatment where everyone was using PPE. They were able to go fix the hearing aids or make any adjustments that they had, deliver the hearing aid back to the patient, and then have a scheduled follow-up appointment with the patient within a few hours when they got back home to actually do a telehealth appointment to see how it was going and to help them use their newly modified equipment. And then also to be able to do follow-ups 2 weeks and 3 weeks later, so that way they can make sure that the adherence part of it was actually happening, making sure that they're actually using the hearing aid. Because we know that when a person actually uses their devices, it's a vast improvement in their quality of life by being able to connect with loved ones. It reduces the amount of dementia patients that we have in the elderly, and it's just making them feel more connected to the world around them. So thank you very much for having us, and passing it back to you, Jess.
Thank you, Sean, for sharing Cycle.net's solution. It's incredibly inspiring to hear how you're able to help facilitate follow-up care for patients and how bringing in family members can create a more meaningful and therefore responsive patient experience as well. With that, I'm thrilled to introduce John Davis, an engineer here at Twilio, who will be sharing and walking through a demo with us.
Thanks, Jess. Hi, everyone. My name is John Davis. I'm an engineer at Twilio from San Francisco, and I want to go over a demo. It's a demo of a patient-doctor experience that was built on top of the Twilio customer engagement platform. You're going to see technologies that makes healthcare accessible to anyone in the world. So we'll go through the demo, and then we're going to look at it again in slightly more technical detail. And then we'll end with some developer resources so you, as a developer, or for your developers to get started building healthcare applications today. Mike just received an appointment reminder notification over text messaging, and Mike has hypertension. And for a portion of the population, there is no medication that will solve for hypertension, because what Mike actually has is sleep apnea. Today, he is finally learning to use the sleep apnea machine that came in the mail. With not ever having to set foot into a doctor's office, Mike's receiving this machine. Just like Steph, earlier when Jess was talking about Steph, he's got kids. Mike's got his kids in the other room. He doesn't have to drive to a different city. In the comfort and the safety of his own home, he's going to speak with his doctor. So he just received a text message, and it says, "Hey Mike, your appointment's ready, it's time. Do you want to start it?" He says, "Sure." Okay, click this link, join the lobby, and that's it. Now he's talking with his doctor. And it looks like he's talking to Dr. Fauci? Okay. Mike's talking to Dr. Fauci. Dr. Fauci is teaching Mike how to use the CPAP machine. And so the doctor says, this is how you turn it on. This is how you change the filter. This is how you put on that nose mask. he says, just wear it, get used to it, and in a couple months we'll go over your vitals and see how you're doing. He says, okay. I hang up. Mike just received one more text message. It's for a CSAT. And now it says, Mike, do you want to fill out a CSAT over text, or do you want to get an email sent to you and you go to the link in the email to go to your secure portal? It's a little bit longer. He says, okay, just send it to me over text. Fills out a quick survey over text, and that's it. Like, to this day, if Mike was really to fill out that survey, he would actually get it mailed to him. Get it mailed to him, he'd open it up, and he'd circle some 1s and some 5s and some 3s, whatever. He'd wrap it back up, and then he'd mail it off. It's an incredibly low adoption rate. Switch to a customer's preferred channel. Let's talk about architecting for HIPAA. So we saw the patient-doctor journey. In the beginning, Mike received a text message, the ending on text messages as well. That was built using programmable SMS, which is HIPAA eligible. How is it HIPAA eligible? Well, to be compliant with it, you need to do phone number obfuscation, which redacts the phone number, and message body redaction, which deletes the body of text messages from the logs between the doctor and the patient, or whoever. I'll provide a link in a few moments with more information about creating healthcare applications that are HIPAA eligible. Point reminders. This is sending notifications to your customers. How did this happen? Well, there's a background service running, and at some predefined interval, it says Mike's got an appointment coming up. Let's go ahead and send him a message over his preferred channel. It's over SMS, so the service knows the to, the from, the message to send, sends it off. It's HIPAA compliant. Twilio Video was used to create the interaction between the doctor and the patient. Specifically, groups was used. With groups, we can add additional participants to the conversation. Mike can add an interpreter if Mike needed an interpreter. Like Jess said, the doctor can add an additional person to the conversation over the PSTN or the handheld phone. Right now, these are pretty incredible times. And what we're really trying to get across is that you can build a secure, high-quality, fast healthcare solution, fast-to-market healthcare solution without sacrificing security. You don't need to use FaceTime. You don't need to use any other insecure technologies. Epic got to market incredibly fast when they embedded Twilio Video into their application. Before, they had 9 different apps. Now they embedded video, and they have an efficient solution so that their doctor can work from one single pane of glass to solve their doctor's needs and make a better conversation or hold a conversation with their patients. And they're not just transcriptionists anymore, they can actually have a conversation. So here's some links to get started to use healthcare or to build healthcare applications. We have HIPAA technical requirements. This answers the question, what does it take to build a HIPAA compliant application using Twilio? Point reminders. This one's on Code Exchange. This is a sample to build appointment reminder applications in JavaScript and Node.js. In the Twilio Video project, I really like this one. This is a blog post that the video team created where it's a link to 3 different applications on GitHub. We have a web-based version that's in React, an iOS version, and an Android version using the video team's best practices to build applications, not just healthcare applications, but any video applications. So I want to say thank you for taking the time today. And I want to say that using technologies like this is a way to give healthcare access to anyone in the world. Bernard Tyson, who led Kaiser Permanente, was famously quoted by saying that the zip code of an individual is a better health indicator than the actual person's genetic code. So by using technologies like Twilio, we can give healthcare access to anybody, anywhere in the world. Thank you. And with that, I'll pass it back to Matt.
Thank you, John, for that amazing demo. In the course of this session, you've heard from my colleagues, Jess and John, and importantly, our customers, Aditya at Luma Health, Chimay from Asteria, and Sean from Cycle.net. What makes telehealth successful is dependent on making sure you are sending the right communication at the right time across the right channel. to make sure that that patient journey is successful. At each step of the journey, from engagement to support to maintenance, Twilio provides the platform for you to deliver next generation patient experiences that can improve patient outcomes. So what have we learned today? Engagement. Increase appointment attendance by honoring patient channel preferences and make rescheduling easy by enabling two-way messaging on your SMS appointment reminders. With automated phone call reminders, use an IVR to provide options to confirm and reschedule. Support. Triage patients through telehealth video visits and make sure your solution is accessible across browser types and devices. Do your patients have the need to download an app, or can they open up a session directly from their browser? How are your patients entering the session? Are you providing options to join if the internet isn't available? And maintain, gain visibility into their care through automated surveys, medical reminders, and provide a path for patients to connect with clinicians when they need to. On behalf of Twilio, our customers and partners, thank you for spending time with us today. We can't wait to see what you build. We would love the opportunity to hear directly from you and get your feedback about how today's session went. Please send a text message to this number and complete a survey. It's only a few questions. Thank you for coming today, and stay safe and healthy, everyone.
Thank you.